There was some big news today about vaccine access. In an extremely close vote this afternoon, the CDC's vaccine panel struck down a motion to require a prescription to receive a COVID vaccine. The panel did vote yes on weakening some guidelines for receiving the shot. Previously, CDC guidance stated that most adults 18 and older should receive an updated COVID shot. The new guidance states vaccinations should be based on individual decision making, and providers should emphasize that the COVID vaccine is more beneficial to people at higher risk. In other vaccine news today, that CDC panel also voted to keep the recommendation as is for hepatitis B. They were considering pushing the vaccine back by a month for newborn babies, which raised extreme concern from doctors nationwide. News 4's Aimee has been working for your health and following the vaccine panel's meeting. She breaks down their decisions and how they will affect you and your family.
Doctors and medical associations from around the U.S. had been sounding the alarm on the risk for babies' health if the hepatitis B vaccine was pushed back. Those doctors were begging the CDC vaccine panel not to make that decision, and today the panel agreed to table it.
When I was a medical student, I actually rotated through a hepatitis ward, and those were the sickest patients I had ever seen in my life.
This is an absolutely safe vaccine. The risk of a severe allergic reaction is probably 1 in a million.
The CDC's vaccine advisory panel has enormous influence on vaccine policy in the U.S. and which shots are covered by insurance. Back in June, HHS Secretary Robert F. Kennedy Jr., a known vaccine skeptic, replaced all 17 members of the previous vaccine advisory panel, who combined had more than 460 years of medical experience. 9 former CDC directors recently wrote an op-ed in the New York Times describing the new vaccine advisors as unqualified individuals who share Secretary Kennedy's dangerous and unscientific views. Yesterday, the new chair of the committee took issue with those comments.
I hereby invite each of the 9 former CDC directors to have a live public debate with me concerning vaccines.
But at today's public meeting, he wouldn't engage when the president of the American College of Physicians did try to debate him.
Respectfully, please stop unmuting me. That is disrespectful. You want debate and discussion, but you're muting people and silencing them.
This week, the new vaccine advisory panel decided to slightly change recommendations around the MMRV vaccine, or measles, mumps, rubella, and varicella, or chickenpox. Children under age 4 are now advised to get separate MMR and V vaccines, and a combined MMRV shot would not be recommended because it brings a slightly higher risk of seizures for kids under age 4, about 8 cases and 10,000. Under the new policy, the MMRV shot would not be covered for kids under age 4 through the Vaccines for Children program, which typically serves low-income and uninsured kids. News 4 spoke with a doctor about what this could mean.
That's definitely a concerning decision because of the implications for coverage for millions of children.
An NBC News investigation found in nearly 80% of counties and jurisdictions in the U.S., vaccination rates have decreased over the past 6 years. Aimee, News 4.
Earlier this month, the Florida Surgeon General said the state will work to eliminate all vaccine mandates, a move that drew widespread condemnation from public health experts.